still warmer than most places you can train at right now. I'm just wearing a jacket because it's swaggy, not because I need it.
So today we're just looking at their medical assessments, just overall looking at the entire body. I first get a background of what their injuries are, because I want to know what they're coming in with. If they're coming in with nothing, I want to know what your injuries have been in the past, because that gives me a good idea of things I should look into further. But I assess the entire body. I want to make sure that I understand exactly what you're coming in with. If it's a mobility deficit, you have a strength issue, endurance, whatever it is, flexibility, so that we can address those things in the weeks to come. We want to prevent injury, and if you do have an injury coming in, we want to make sure we take care of that right away. Sports medicine is really important, and we try to teach the guys that taking care of your body, especially now, is going to help you a lot in the future. So when they go into the NFL, they have to know how to take care of their bodies themselves, and we're hoping to take that first step of teaching them how to do it so that they can be able to take initiative and do it in the future.
What are some of your expectations from the guys today?
My expectation is that they're taking care of their body with the resources that we're giving them. So we're providing them advice on how to take care of their body in terms of rehab, and providing massage therapists, and providing nutrition information, and giving them all of the resources they need. So I expect them to use those resources and ask the questions that they need, because we're here for them over the next few weeks.
We're gonna give you a roll. Yeah, hold it right there, okay? Hold it right there. Hold it. Yeah, don't let it go.
I got you.
Don't let it go.
Punch in the chin or just a walk by?
Hey,
He didn't punch me, so we good.
Yeah, what is the FMS? What are we doing with FMS?
So the FMS is the functional movement screen, and what we use that for is to see how well these guys are moving. Coming in out of season, sometimes they're picking up injuries, sometimes they just develop poor movement patterns over time and poor movement habits, and those are things that can potentially lead to injury. So what we want to do is assess them, screen them in a multitude of different ways, and see how they're moving, so we can try and prevent some of those injuries and head those things off.
What about the band that the guys doing Christian?
So what we do here is we work a lot on glute endurance. So we want to make sure that they come in with the proper glute strength and glute endurance, so that we can prevent some knee injuries that are kind of common to the sport. So it's just another tool, another piece of information that we can utilize as part of the whole to then create a comprehensive plan for these guys while they're here.
So your role within this pre-draft process, it's a lengthy process. What do you do specifically for the guys?
So me specifically, I work kind of a dual hybrid purpose here. So one of the things is obviously movement and ensuring that the guys are moving well in their drills, in their weightlifting programs. That's one of those things that I'm going to be in here and make sure I have an eye for, and I'm watching the quality of movement. The other thing is then, when we find a deficiency, I'm part of the team that's going to help create the solution for that deficiency, create the mobility program, the rehabilitation program that's going to help them move more efficiently while they're here.
What was your expectation today for the guys?
Today is just getting back into the swing of things. A lot of these guys are coming straight off of season. They haven't been doing a lot of lifting, haven't been doing a lot of moving, and today's just about movement. This whole week is just about movement, kind of dusting off the cobwebs. And what we've seen today is we've got a lot of performers. We've got a lot of freak athletes that are going to kill it this combine.